Hi, Joe Alton, MD here, also known as Dr. Bones of the survival medicine website doomandbloom.net, co-author of the greatly expanded Amazon Top 20, 4th edition of the Survival Medicine Handbook, and designer of quality medical kits at store.doomandbloom.net. In Part 1 and Part 2 of this series, we discussed the different types of diabetes and their complications. In Part 3, we'll discuss what the medic's treatment strategies should be off the grid. Being the end of the line with regards to control of diabetics in times of trouble won't be easy. You may have learned how to splint a fracture or clean a wound, but treating chronic medical illnesses like diabetes, well, that's going to be quite a challenge even for some medical professionals. Your goal for diabetics in survival scenarios won't be the same as it is in normal times. Tight control of sugar levels involves aggressively expending items like test strips that will be in short supply in times of trouble. When the grid's down, your goal should be to balance the available insulin and other supplies with the glucose control, especially in type 1 diabetics. This must be done in such a fashion not necessarily to keep glucose levels normal, but to keep them below that seen in diabetic ketoacidosis, a high glucose emergency we mentioned in earlier videos. I have absolutely no scientific proof for this strategy other than plain logic. Insulin, like most liquid medications, will lose potency relatively quickly after it expires. Batteries and other power sources are needed to maintain things like insulin pumps, glucometers, and other paraphernalia needed to tightly control blood sugars. What happens when the batteries run out? What happens when you run out of test strips? If the you-know-what hits the fan, you'll find yourself in the unenviable position of making decisions as to how to dispense precious and limited commodities. Therefore, unless this disaster scenario is very short term, you can't afford to expend supplies in the manner necessary for tight diabetic control. This hard fact leaves you with having to accept the possibility that you'll have to keep your type 1 diabetics at higher glucose levels than you would like. If you're unable to check blood sugars, as a matter of fact, your only guide will be physical signs of ketoacidosis. These signs and symptoms include excessive hunger, excessive thirst, frequent urination, nausea and vomiting, abdominal pain, weakness, fatigue, confusion, shortness of breath, and fruity scented breath, also called ketosis. The product labels recommend that insulin be stored in a refrigerator at approximately 36 to 46 degrees Fahrenheit. Unopened and stored properly, it maintains potency until the expiration date on the package, usually about a year. Open vials kept at room temperature are thought to last only about 28 to 42 days, depending on the insulin type. Now, that doesn't mean that it's necessarily useless the day after, but it loses strength rapidly. So what would you do when a disaster leaves you with a limited amount of insulin and no ability to get any more? Well, there's no CDC recommendation, as far as I can tell, that addresses this subject. Therefore, the following is purely my opinion. It's a strategy for a post-apocalyptic setting, not for normal times. One option is to take the insulin as usual until it runs out. This will assure normal control for the time being. You can even continue to check glucose levels if the batteries are still good. This is the simplest and certainly most optimistic strategy. Hopefully, society will restabilize in time for insulin manufacture to restart. If it doesn't, rapid deterioration of your diabetic patients may occur once the insulin runs out. Another option is to ration the insulin. Your goal would be to give just enough to prevent diabetic ketoacidosis. If you were able to measure blood glucose levels, you'd shoot for a value of close to maybe 200. This value is much higher than normal, but lower than usually seen in diabetic ketoacidosis. It's a grim strategy because you'd be shortening your patient's lifespan, even if it works, to improve the current situation. Insulin adjustments will be difficult to make. There are no studies that evaluate what the effect of withholding part of an insulin dose would be. The same goes for using expired insulin. Insulin that's clear when new should not become cloudy, should not change color, or accumulate debris at the bottom of the bottle. These are signs that it has degraded and should be discarded. An additional strategy for diabetics, especially type 1, would be to strictly regulate diet and subsist on a diet almost entirely comprised of protein and fats. The key is to restrict caloric intake from carbohydrates. Give barely enough to maintain normal weight. This is another incredibly unhealthy practice in the long run, but may prevent ketoacidosis for a time. With regards to type 2 diabetics, it's most often seen in older, heavier, and less active individuals. In survival settings, type 2s will experience dietary restriction and increased physical activity as a result of, The survival scenario, things that are recommended to treat it in normal times. I suspect that a number of type 2s will find their condition doesn't worsen, especially if they started off overweight. Eating small, frequent meals and staying active may even improve some of the more minor cases. Here's where careful attention to appropriate food storage will help. Plan for a balanced diet high in fiber, low in saturated fats, and of course low in concentrated sugars. The most popular medication used for treatment of type 2 diabetes is called metformin. It works in various ways, including increasing the cell's sensitivity to insulin. In tablet form, it's a good candidate for long-term medical storage. There are even a few studies that indicate that metformin may help with type 1 diabetes, although these are considered quite controversial. Remember, any diabetic for whom you'll be responsible should be evaluated now by a physician. The better the diabetic control before a disaster, the less organ damage that has occurred, and the higher the chance for survival. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching. Hey, learn more about diabetes and 200 other off-grid medical issues in the 2022 Book Excellence Award winner in Medicine, the 4th edition of the Survival Medicine Handbook. Available in black and white on Amazon, or get a color signed copy at store.doomandbloom.net. You'll be glad you did.